Hey, this is Hospice Care Queen Nancy, and we've been talking about pain. How many words can you think of that actually describe pain? When you're having pain or discomfort, it can be really hard to describe what you're experiencing, and yet it's so very important for your hospice team. They need to know as much as possible about your pain so they can find the best way to relieve it. Let's talk about some practical ways to describe your pain or discomfort. First, pretty simply, the location. Where is the pain? Is it in your chest, your back, your legs, your head? Is it in one spot? Maybe it's your whole body. Or does it start in one spot and radiate to another one or move around? So be careful. Where is it? And secondly, let's talk about the intensity. This is so important so we can find a medication that can work quickly or one that lasts longer. We used a lot of different ways to scale the level of pain, and I'm sure you've heard of that scale, which uses numbers 0 to 10. And know that that pain scale is still used all the time, but it is so subjective to every person, and often it can even change for that one person from day to day or even hour to hour. So it is subjective. But just to review, we use a 0 to 10 scale. 0 is no pain, 10 is the worst imaginable pain. So you might find it easier instead to use a few words. So try moderate, which might be 0 to 3 pain, moderate, 3 to 5, severe or unbearable, and that could be 10 or even greater than 10. Okay, let's move on to what's really important that we don't do very well at, and that's the quality of the pain. What does it feel like? Now, this is a really difficult thing to do, and I'm going to remind you of some more words that could be descriptive. You might actually jot one or two down if they match the discomfort you're having or you've had in the past, but you've never really thought of these words to describe it. Here they come. I'm going to say them slowly so you can write them down if they apply. Sharp, stabbing, shooting, burning, aching, throbbing, cramping, dull, heavy, tingling, electric, nagging, squeezing, cutting, flickering, itching, stinging, pricking, pulsing, gnawing, or even boring. There's so many words you may never have thought of. And again, to summarize, your hospice medical team will really have the best chance to help you find comfort if you can help them understand what you're experiencing, really, what you're experiencing from your inside out. Thanks so much for listening. We want you to be comfortable. Brenda and I wrote the booklet, and we do videos all the time to help support all of you people who are in the end of life or palliative care, whatever it is, we're there to help. Please go to our website, the Hospice Care Plan, or pick up our booklet. We're there to support our hospice motto, care is treatment.